Gynecologic cancer affects so many women in different ways, from hair loss because of treatment to removal of certain organs. It's a journey that no one should have to go through. And here to help us understand these diseases better is Dr. Stuart Winkler, gynecologic oncologist with Texas Oncology. Thank you for being here.
Yeah.
It is so important to spread awareness during Ovarian Cancer Awareness Month and Gynecologic Cancer Awareness Month.
Yeah, September is both of those. So.
Wow, lots of awareness to be spread right now. But just to give our audience an idea, how common are gynecologic cancers?
Sure, so I always like to talk about them kind of in comparison to breast cancer because most people are very familiar or more familiar with breast cancer. So breast cancer affects about 300,000 women in the US every year. In gynecologic cancers, it's about 120,000. But gynecologic cancers are very deadly. And so about as many women, about 40,000 women per year die of gynecologic cancer. And that's about the same for breast cancer.
That is a high number, you know. And as a survivor of ovarian cancer, I just always want to tell women, and they've heard me say this year after year, you must be aware of your body, you must listen to your body. And so getting into that, we wanted to focus a little bit on ovarian cancer and just remind people of the symptoms. What are the symptoms?
Yeah, so they're pretty nonspecific, unfortunately. So bloating and what we call early satiety, which is where you feel full a little bit faster than maybe normally. Those are sort of the main symptoms that we see with ovarian cancer. And unfortunately, that means that many women are diagnosed later in the disease.
And that's why it is considered to be sometimes too late for certain treatments. I know a lot of women who they caught it very, very late, very advanced, and it was very difficult to treat. So that's why it's like, listen to those symptoms, you know?
Yeah, absolutely. I think that's important. I think also we know that about 20% of ovarian cancer is hereditary, so is passed down through the family. And so if you have a family history of breast or ovarian cancer, it's just really important that you let your doctor know that.
Certainly, and another risk factor is age as well.
Absolutely, yeah. Most of our patients with ovarian cancer are older. Obviously, sometimes patients are younger, like unfortunately in your case, but most of our patients with ovarian cancer are older, and that's kind of the biggest risk factor.
Sure, and am I accurate to say, like, if you catch it early, the certain treatments can be helpful?
Yeah, for sure, for sure. So our mainstays of treatment really are surgery and chemotherapy, and absolutely, if we catch that earlier, those treatments are more effective.
And what types of treatments are there? It's pretty neat how specific they are, right?
That's right, yeah. So really, probably the biggest thing that we've seen recently with GYN cancers and with ovarian cancer are these targeted therapies. And so if you think about a tumor as having like an address on it, a targeted therapy is sort of like a stamped envelope with treatment that goes straight to that address. And so we're seeing better outcomes for patients who have markers on their tumors that allow for targeted therapy.
That's incredible. You know, it kind of gives you hope. Obviously, when you hear the words you have cancer, it is just terrifying. And then you lose your hair and you're just like, I'm not myself. And so to have a little bit of reassurance there with that targeted treatment, I think it's really good news. And if a woman is maybe concerned, maybe she has some of the symptoms, what is your biggest suggestion for them?
Yeah, the biggest thing is just to speak up when you're talking with your doctor. You know, your doctor can do an exam, maybe some imaging and that sort of things based on your symptoms, and really that's the best way to go about it.
Yeah, because there's no actual screening for ovarian cancer like there is for breast cancer. I always say that too, because it's important to know that, hey, you're not crazy if you're feeling something, just go get it checked out.
Absolutely.
How can people reach out to you guys or, you know, inquire about a certain concern?
Sure, so texasoncology.com is a great resource. The Foundation for Women's Cancer is also a resource that I use with patients sometimes that has great patient-facing information, but all that can be found at Texas Oncology.
Well, doctor, thank you for all of this. I'm so glad you're here today. Thank you for wearing teal as well. Your bow tie looks awesome, your ribbon. We are spreading teal awareness, but we also